Dr. Danielle has a busy day seeing patients back to back in her clinic. One of her patients is Sean. Sean is 48 years old. He has a good relationship with Danielle and has been visiting her regularly for years. Danielle helps Sean manage a range of health issues he has, including diabetes, high blood pressure, and back pain. She also helps Sean manage his medication. Danielle gives Sean his depot injections to help manage his schizophrenia, as well as antidepressants to manage his generalised anxiety disorder. Sean's back pain limits his mobility and can get in the way of him doing things. Danielle is also worried about its impact on his social life and daytime activities. Danielle knows it's not just medication that Sean needs. He's lonely and unsure, and his social isolation is contributing to his anxiety and his ability to take care of himself. Imagine if Danielle could prescribe a different kind of care for Sean. Imagine instead of just drugs for his anxiety, Danielle could prescribe gentle exercise, a cooking class, and movie nights. Sean would be able to work on his fitness, learn how to cook an appetizing meal, and make new friends through a shared interest. He'd be better able to better manage his diabetes and blood pressure, as well as his mental health issues. He'd be less likely to need Danielle's care, and he'd have a much more enjoyable and manageable life. That's not as far-fetched as it sounds. GPs do a great job of supporting their patients' health, but a patient's health is often affected by their social circumstances and well-being. Primary and Community Care Services Plus Social program allows Gold Coast PHN GPs and psychiatrists to implement solutions that improve the quality of life for their patients and reduce costs to the health system. In addition to providing comprehensive physical and mental health care navigation, Plus Social also incorporates a social prescribing-based approach to address unmet social and well-being needs. So what is social prescribing? Social prescribing encompasses a range of non-clinical interventions designed to improve patient health and well-being. It adopts social models of care that link patients in the primary care setting with sources of support within the community. Social prescribing allows GPs to approach patient needs in a holistic way to address overall well-being. It gives them the ability to prescribe additional services not normally available to them in the current health system. So how does it work? PCCS's Plus Social program works within a GP's usual model of care. During a consultation, GPs who identify patients with serious mental illness and complex needs can make a referral to the Plus Social program. It works just like any other referral. Dr. Danielle phones PCCS to talk about the service options and pathways available to Sean. She decides to make a referral to Plus Social. Sharon, a PCCS link worker and experienced psychiatric nurse, meets with Sean that week to discuss his needs and make a plan. Sean has assistance from a support service to clean his house and help with shopping, but they've warned him that as the NDIS rolls out in the Gold Coast, that he might not be able to get the same level of support. This has made Sean even more anxious. Sean also tells Sharon about problems he's having around the house, including showering and toileting, due to his worsening back pain. He's worried that he's going to hurt his back even further and isn't confident in staying healthy in his own home. Sean and Sharon also talk about other practical concerns, like how Sean's going with his finances, how he's finding managing his diabetes, and what he gets up to during the week. Sharon makes an initial action plan with Sean and starts connecting to the people in Sean's life who are important in meeting his goals. Sharon checks back with Dr. Danielle around Sean's plan to keep her in the loop. With Sean and his GP at the centre of care, Sharon puts into action a multi-agency care plan that ensures his physical and mental health needs are well coordinated. Sharon makes an internal referral to one of the occupational therapists on the team to look at his concerns around being able to manage at home. The OT completes a functional assessment and home assessment and makes a number of recommendations, including the installation of handrails and referral to the NDIS. Sean is supported through the NDIS application process, including coordination of documentation and initial service coordination. Sean is relieved to have someone help him through the process. Sharon invites Sean to attend social participation groups near his home to meet his goal of increased daytime activities. Sean tells Sharon that he's not confident with cooking and that he often throws away groceries at the end of each week. Sean is worried that his eating at the McDonald's at the service station near his house is making his diabetes worse. Sean joins the cooking group running at the Hub on Thursday evenings. Through the cooking group, he develops connections with other consumers, peer workers and student clinicians. After 10 weeks, he tells Sharon that he feels confident preparing some basic healthy meals that are low in carbohydrates. He's enjoying the social contact so much that he also joins a light walking group that some of his cooking group mates are in and begins to increase his weekly movement. While working with Sean, Sharon also builds a closer connection to Dr. Danielle's practice. The practice manager invites Sharon to provide an in-service. She and the PCCS nurse educator present to staff at the practice. This leads to further consultation and assistance to this practice over a 2-year period, supporting skills, knowledge and competence in the area of comorbid chronic disease management. PCCS's Plus Social Program's evidence base is well established. There are more than 50 international studies on social prescribing that have shown individual improvements in general health and mental well-being, and reductions in health and social service utilisation. Many of these studies have demonstrated a positive economic return on dollars invested in the program. In a small pilot study of Plus Social for people with serious mental illness evaluated by Southern Cross University Gold Coast, evaluators found significant improvements on most self-report measures, including overall health satisfaction, self-reported health status, and physical and psychological quality of life. There was also a significant decrease in hospital admissions. Australia, like most countries, cannot sustain its current growth rate of health expenditure. While the system generally works well, it still leaves patients like Sean in a difficult place and at risk of needing increased medical care. It's worthwhile implementing new ways of providing holistic care with a high potential to reduce longer-term costs to the system, especially as they can result in immediate benefits and sustained health and well-being for patients. Social prescribing gives Dr. Danielle more options for patient care and ensures patients like Sean receive the kind of care that improves quality of life. That's a win for GPs, patients and the community. PCCS's Plus Social Program: social interventions, clinical impacts, human results.